Hello, I'm James Fitzgerald. Welcome to the next video in this series that supplements my professional public disclosure statement. In this video, you'll learn about my work and training experience, including a brief history of the different career paths that have all influenced my approach and led me to where I am today. If you haven't done so already, I encourage you to watch the other videos in this professional public disclosure series first. The videos preceding this one cover my education and undergraduate studies at the College of St. Joseph the Provider and graduate school studies at the University of Vermont. Let's begin first with my current role. I'm a Vermont State licensed clinical mental health counselor with the Vermont Secretary of State's Office of Professional Regulation and by the Board of Allied Mental Health Professionals. I'm a National Certified Counselor by the National Board of Certified Counselors. I'm a member in good standing of the American Counseling Association. I'm an active member of the Vermont Counseling Network. I'm a certified life coach and certified health and wellness coach. Strengthening Your Conscious Self is the name of my holistic health and wellness program, therapy program, and universal treatment plan. James Fitzgerald Therapy is the name of my professional limited liability corporation and private practice. The therapies, theories, and approaches I've included in Strengthening Your Conscious Self that I have received extensive training on include the following: acceptance and commitment therapy. Places an emphasis on values and psychological flexibility, using mindfulness practice and an attitude of acceptance as the foundation of the work. Character strengths and virtues. A descriptive theory, not prescriptive, with the emphasis on classifying psychological ingredients of moral and ethical goodness in human beings across cultures, nations, and beliefs, rather than prescribing what humans should do to be good, moral, ethical, or improve themselves. Cognitive behavioral therapy. Places a focus on our core beliefs, schema, and thinking patterns. Dialectical behavior therapy emphasizes mindfulness as the foundation of emotion regulation, distress tolerance, and interpersonal effectiveness. Emotional focused therapy includes learning emotional, social, and interpersonal intelligence. Existential theory explores the meaning of life and how to live an authentic life, based on the idea that people are free to choose their own existence and meaning, and that they are responsible for their actions. Feminist theory focuses on issues such as discrimination, objectification, power, and oppression, and analyzes how gender shapes people's experiences and the social world. Gestalt theory, also known as Gestalt psychology or configurationism, is a theory of perception and school of psychology that focuses on how people process patterns and configurations as a whole, rather than individual components. Health psychology focuses on psychological, physiological, and behavioral processes in health, wellness, and healthcare, and is concerned with understanding how psychological, behavioral, and cultural factors contribute to physical health and wellness. Humanistic theory focuses on the potential of individuals, their inherent goodness, and their drive to achieve self-actualization. Internal family systems. A theory of multiplicity views the mind as subdivided into a family of subpersonalities or parts that interact with each other in our psyche, in our mind, our conscious awareness, and subconscious activity. Mindfulness-based cognitive therapy combines mindfulness meditation with cognitive behavioral therapy to help people learn to relate to their thoughts and feelings in a new way, rather than avoiding or reacting to them automatically, using mindfulness practices to help people disengage from negative thought patterns, and cognitive behavioral therapy techniques to help people become more aware of those patterns. Mindfulness-based stress reduction, a complementary or supplemental therapy that helps people reduce stress levels, manage anxiety and depression, and cope with chronic pain, teaching mindfulness techniques that combine breathing exercises, meditation, and yoga or stretching. Motivational enhancement therapy. With motivational interviewing, with Socratic questions based on the trans-theoretical stages of change model of behavior. Narrative theory considers the role of storytelling in shaping our perceptions of the world, based on the idea that humans create narratives to understand and process their experiences, and that storytelling is a fundamental human strategy for dealing with change, time, and processes. Nutritional psychology is centered around exploring why individuals make the decisions they do regarding food choices, integrating psychological theories to understand causes, and considering empirical evidence as to how individuals can be supported to overcome barriers to changing behaviors that impact their health. Polyvagal theory explains how the vagus nerve in the autonomic nervous system affects emotion, social connection, and fear response. And it's important to mention that this approach has not been debunked, however, does have its criticisms. Positive psychology teaches individuals how to improve their quality of life by focusing on positive emotions, optimal functioning, and holistic wellness. A combination of positive emotions, engagement, relationships, meaning, and accomplishment, PERMA. Positive psychology aims to help people create a satisfying life filled with meaning, pleasure, and engagement by teaching strategies and skills that help people navigate life's challenges and enjoy life despite setbacks. Sensory motor psychotherapy. A mind-body-based therapy integrates current neuroscience research to transform traumatic memories into strengths and resources, working with developmental trauma such as maternal lack of attunement, as well as acute or gross trauma like assault or abuse. Sensory motor therapists work on mindfulness in collaboration with the client, repeatedly asking permission to do each experiment or process. Somatic experiencing aims to resolve symptoms of stress, shock, and trauma that accumulate in our bodies and nervous systems, how it shows up in the nervous system, and how that dysregulation impacts life and helps us release, recover, and become more resilient. It is a body-oriented therapeutic model for healing trauma and other stress disorders from a nervous system lens, and is based on a multidisciplinary intersection of physiology, psychology, ethology, biology, neuroscience, indigenous healing practices, and medical biophysics. Psychodynamic theory studies how psychological forces influence human behavior, emotions, and feelings, based on the idea that childhood experiences are a crucial factor in shaping adult personality and relationships. Some key assumptions of psychodynamic theory include all behavior has an underlying cause. The causes of a person's behavior are rooted in their unconscious, and our behavior and feelings are rooted in childhood experiences. Many of the principles and concepts of these theories intersect and complement each other, and they add something to my eclectic approach to helping others. Now, let's look at my experience. Throughout my mental health care career, I gained valuable, extensive experience in various roles, including working in the following settings, in chronological order, starting in 2012. From September of 2012 until June 2013, I volunteered at the Turning Point Center of Rutland, Vermont. In that role, I cooked community meals, led support group meetings, performed light cleaning duties, answered the phones, checked in guests, helped support community members looking for recovery resources, and asked guests to fill out anonymous surveys to measure outcomes of the organization's outreach and recovery coach program. I worked as a community outreach worker for Vermont psychiatric survivors from 2013 to 2014. I worked as a peer support specialist and recovery coach. As part of my duties at Vermont Psychiatric Survivors, I was a public community liaison at Project Vision in Rutland, which is a cooperative partnership of community members, business leaders, city government, law enforcement, criminal justice, the corrections department, Rutland Regional Medical Center, Vermont Recovery Network, and the Turning Point Center of Rutland. I worked for Vermont psychiatric survivors as part of a grant that funded a program called Community Links. I worked for Rutland Mental Health Services in a residential crisis stabilization and inpatient diversion program from June of 2014 to June of 2016. I held multiple roles here as a peer support service coordinator and crisis intervention and stabilization support specialist. The program is a short-term licensed residential mental health crisis stabilization program. The program is designed to provide immediate, intensive, and supportive care for individuals experiencing acute mental health crises. These types of programs aim to stabilize clients' mental health symptoms, reduce the severity of the crisis, and divert individuals from inpatient hospitalization when possible. They are often used as an alternative to hospitalization for those who need a high level of support, but can be safely cared for by a program outside of a hospital environment. The program typically offers structured care for individuals in crisis for a duration ranging from a few days to several weeks, depending on the severity of symptoms and the individual's progress. The primary objectives are to stabilize the client, assess their mental health needs, and create a safe transition plan for continued care in less restrictive settings. These programs are often licensed and regulated by state or local authorities to ensure that they meet established safety and care standards. The program provides immediate intervention by mental health professionals, including recovery specialists, peer support specialists, counselors, psychiatrists, and nurses, to address acute symptoms such as severe depression, anxiety, psychosis, suicidal ideation, or other behavioral health crises. It includes 24-hour supervision and monitoring by staff. Clients receive continuous support and supervision to ensure safety, medication compliance, and crisis management. This 24-hour care reduces the risk of harm and provides immediate response capabilities if symptoms escalate. Psychiatrists provide medication evaluation and management to stabilize acute symptoms. Adjustments to medication may occur based on ongoing assessment and client response. The program incorporates psychoeducational sessions to help clients understand their condition and develop coping strategies with a focus on relapse prevention and effective crisis management techniques. The program's multidisciplinary team works to connect clients with outpatient services, community resources, and support networks for continued care. This includes coordinating follow-up appointments, support groups, or outpatient therapy, and ensuring that the client has a comprehensive discharge plan in place. These programs serve individuals experiencing severe mental health symptoms, but who may not meet the criteria for full inpatient hospitalization or whose needs can be met safely in a residential setting. This can include individuals with severe anxiety, depression, mood disorders, psychotic episodes, or individuals in need of stabilization following a suicide attempt or intense suicidal ideation. The program's goals and outcomes include achieving symptom reduction to a manageable level that allows for safe discharge and transition to lower levels of care. The program's goals and outcomes include avoiding unnecessary inpatient hospitalization by providing intensive support and resources in a less restrictive community-based environment. The program's goals and outcomes include ensuring that clients have a solid aftercare plan and are connected with outpatient therapy, medication management, and community support services to prevent future crises. The length of stay in these programs is usually short-term, ranging from a few days up to 2 weeks, with flexibility based on the individual's needs and progress toward stabilization goals. By providing an intensive but less restrictive environment, these programs aim to reduce the burden on hospital systems, offer clients an alternative that supports recovery in a safe, therapeutic setting, and emphasize the importance of continuous care and support after discharge to minimize the risk of future crises. I also worked for Rutland Mental Health Services in a residential recovery program from June of 2014 to June of 2017. A long-term licensed residential mental health stabilization and recovery program is a comprehensive and structured treatment setting designed to provide intensive, individualized care for individuals experiencing severe or chronic mental health conditions. These programs offer a therapeutic environment that supports the stabilization of symptoms and promotes long-term recovery through evidence-based therapies, medical management, and holistic interventions. They are suitable for individuals whose mental health challenges require a level of care and support that cannot be effectively provided in outpatient settings or short-term inpatient facilities. The primary purpose of a long-term residential program is to provide a safe, supportive, and therapeutic space for individuals who may be experiencing severe depression, anxiety, bipolar disorder, schizophrenia, personality disorders, trauma-related disorders, or other complex mental health conditions. These programs are designed to stabilize acute symptoms, address underlying psychological and emotional issues, and foster recovery through a multidisciplinary approach. The length of stay can vary, often ranging from several months to a year or more, depending on the individual's needs and progress. Each resident undergoes a comprehensive assessment upon admission involving medical, psychiatric, psychological, and social evaluations. This allows the clinical team to create a personalized treatment plan tailored to address specific symptoms, underlying conditions, and goals for recovery. Treatment plans are regularly reviewed and adjusted as progress is made. Residents receive round-the-clock care and monitoring from licensed professionals, including psychiatrists, psychologists, counselors, nurses, and support staff. This ensures that individuals have immediate access to medical and psychological support during crises or emotional distress. For individuals requiring pharmacological intervention, psychiatrists provide ongoing medication management, monitoring for effectiveness, and adjusting prescriptions as needed. This component of care is crucial for stabilizing symptoms and helping residents manage their mental health effectively. Group therapy is a core aspect of residential programs, offering residents opportunities to develop interpersonal skills, build social support, and share experiences with others in a safe and guided setting. Psychoeducation groups provide information about mental health, coping strategies, relapse prevention, and skills for independent living. Programs often integrate holistic therapies such as yoga, meditation, art therapy, music therapy, and physical fitness. These activities support residents in developing a mind-body connection, managing stress, and improving overall well-being. Nutritional support and wellness counseling may also be offered, as proper nutrition and physical health are closely linked to mental health stability. Long-term residential programs emphasize teaching residents life skills essential for independent living, such as time management, personal hygiene, budgeting, meal preparation, and social skills. Some programs offer vocational support, job readiness training, or educational services to help residents prepare for a transition back into the community and achieve self-sufficiency. As residents progress, the focus gradually shifts toward preparing for discharge and reintegration into the community. This includes supervised outings, participation in community-based support groups, and developing coping strategies for triggers or stressors they may encounter outside the facility. Programs often collaborate with outpatient providers, support groups, and community resources to create a seamless aftercare plan, ensuring continuity of care and reducing the risk of relapse. The environment in a long-term residential program is structured to provide consistency, safety, and support. Residents typically follow a daily schedule that includes therapy sessions, group activities, self-care time, meals, and recreational activities. The aim is to create a balanced routine that encourages healthy habits, offers opportunities for social interaction, and provides therapeutic engagement throughout the day. Staff foster an atmosphere of respect, compassion, and non-judgment, ensuring residents feel valued and heard. Long-term residential mental health programs are licensed by state regulatory bodies and must adhere to specific standards and guidelines to ensure safety, efficacy, and quality of care. Many programs also seek accreditation from organizations such as the Joint Commission or the Commission on Accreditation of Rehabilitation Facilities, CARF, to demonstrate their commitment to excellence and best practices in mental health treatment. Ideal candidates for long-term residential programs include individuals who may not have responded adequately to outpatient or short-term inpatient treatments, or individuals who require a high level of clinical support to manage severe symptoms or behaviors, or individuals who struggle with co-occurring disorders such as substance use disorders, trauma, or personality disorders, or individuals who need intensive support and structure to develop independent living skills and coping strategies, or have difficulty maintaining stability in less restrictive environments and need a longer-term therapeutic space for recovery. The long-term nature of these programs allows for deep therapeutic work that addresses root causes of mental health issues, develops coping mechanisms, and builds resilience. Residents often experience improved symptom management, greater emotional regulation, and an increase in their quality of life. Additionally, the comprehensive approach helps residents develop the skills and resources needed to maintain stability and continue recovery once they transition back into the community. At both facilities, I was a peer services coordinator from 2014 to 2015. I switched roles to a recovery support specialist at the long-term facility and a crisis intervention support specialist at the short-term facility from 2015 to 2016. And I switched to working at just the long-term facility from 2016 to 2017. The programs were also where I filled my course requirements of field experience, which was applied toward my bachelor's degree. A residential recovery support specialist in a long-term residential recovery program is responsible for providing direct, person-centered care and support to individuals with persistent and severe mental health conditions. This role operates under a community mental health care services organization and designated county agency by the state of Vermont, emphasizing a recovery-oriented approach. The recovery specialist works closely with residents to promote emotional well-being, personal growth, empowerment, and independence through individualized recovery plans, skills training, and group activities. Key responsibilities include fostering a safe and supportive environment, assisting residents in daily living tasks, monitoring and recording patients' progress, light cleaning duties, monitoring safety, advocating for clients' needs, and collaborating with clinical teams to ensure comprehensive care. The role requires strong interpersonal communication skills, empathy, and a thorough understanding of recovery principles, with a commitment to empowering individuals to achieve their personal recovery goals. The Crisis Intervention and Stabilization Support Specialist plays a critical role in a short-term crisis intervention, stabilization, and inpatient hospital diversion program within a community mental health care services organization. This position focuses on providing immediate support and interventions to individuals experiencing acute mental health crises, aiming to stabilize their conditions and prevent the need for hospitalization. The specialist works closely with a multidisciplinary team to assess clients' needs, develop personalized crisis intervention plans, and deliver therapeutic services in a safe, supportive environment. Responsibilities include observing behavior to contribute to risk assessments, delivering de-escalation interventions, providing emotional support, and coordinating care with external providers and community resources. The specialist facilitates short-term stabilization through group counseling, crisis planning, and monitoring. Additionally, they cook meals, perform light cleaning duties, and assist clients in connecting to long-term treatment options and support networks to ensure ongoing mental health and well-being after discharge from the program. This role requires strong clinical skills in crisis management, a compassionate approach, and a deep understanding of mental health challenges. Experience in mental health care settings, crisis intervention techniques, and knowledge of community resources is essential. Collaboration with hospitals, emergency responders, law enforcement, and family members is also a key part of the role to ensure holistic, client-centered care. I served in dual roles as a peer support specialist and peer support services coordinator within these two distinct programs, a long-term residential recovery program and a short-term crisis intervention, stabilization, and inpatient hospital diversion program. Both programs were part of a community mental health care services organization dedicated to supporting individuals with mental health and substance use challenges. As a peer support specialist, I used my lived experience of recovery to provide empathetic support, mentorship, and advocacy. I was able to build trusting relationships, offered hope, and guided clients through their recovery journey by sharing personal experiences, fostering empowerment, and supporting the development of self-management skills. In the role of peer support services coordinator, I assisted clients with connecting to peer support services in their community, ensuring that the services were integrated into the broader treatment plan. My responsibilities included coordinating peer support services, providing a binder of resources, developing wellness recovery action plans, and ensuring services align with best practices and organizational goals. Additionally, I collaborated with clinicians, case managers, and community partners to ensure the smooth delivery of services in both the residential and crisis setting. Overall, I was able to contribute to a person-centered approach to care, prioritizing recovery, resilience, and stabilization for clients in both long-term recovery and crisis intervention settings. From 2017 to 2020 in Burlington, Vermont, I worked for the University of Vermont Medical Center as a mental health technician for the psychiatry department. Without divulging proprietary or confidential business practices at this hospital, here's the standard operating procedure and organizational structure of any typical hospital's inpatient psychiatry department. A psychiatric department in a hospital setting that partners with a licensed county mental health services agency's crisis services, emergency department services, a multiple bed involuntary inpatient unit, and a multiple bed voluntary inpatient unit is designed to provide comprehensive mental health care across various levels of need and severity. This collaboration ensures that individuals in crisis receive timely and appropriate care, ranging from crisis intervention and emergency stabilization to short-term inpatient treatment. Here's how such a department might be structured and function. The psychiatric department is closely integrated with the hospital's emergency department, which serves as the entry point for most individuals experiencing acute mental health crises. The emergency department has psychiatric staff available, including crisis intervention specialists, psychiatric nurses, and on-call psychiatrists who can perform initial assessments, provide immediate stabilization, and determine the appropriate level of care. This process may involve working closely with the county's crisis services to facilitate coordination and continuity of care, particularly for patients who are transported to the hospital by crisis teams or emergency medical services. The partnership with the County Mental Health Services Agency's crisis team ensures that there is a collaborative approach to crisis intervention, allowing for rapid and coordinated responses to psychiatric emergencies in the community. The crisis team works both in the community and in the emergency department to stabilize individuals and determine if they need further inpatient treatment or can be diverted to less intensive services such as crisis stabilization units or outpatient programs. This partnership ensures that individuals receive appropriate care while reducing unnecessary hospitalizations when possible. The psychiatric department includes two distinct inpatient units. The involuntary emergency inpatient unit is for individuals who require intensive psychiatric care and are unable to voluntarily commit themselves for treatment due to the severity of their mental health condition, often under civil commitment or involuntary hold laws. Patients admitted here may be experiencing severe symptoms such as psychosis, acute suicidal ideation, or other behaviors that present a risk to themselves or others. The unit is staffed 24 hours a day, 7 days a week by a multidisciplinary team that includes psychiatrists and psychiatry residents, registered psychiatric nurses, licensed nursing assistants, unit secretaries, mental health technicians, social workers, therapists, and case managers. The team provides medication management, psychotherapy, and crisis stabilization services. Treatment plans focus on stabilizing symptoms, ensuring safety, and preparing for the transition to a lower level of care, such as the voluntary unit, a community-based program, or discharge home with outpatient support. The voluntary inpatient unit is designed for patients who require psychiatric stabilization and treatment, but are able to consent to care voluntarily. Often, these individuals may be experiencing acute depression, anxiety, mood disorders, or other severe but manageable symptoms that do not pose an immediate danger to themselves or others. The voluntary unit provides a structured and therapeutic environment where patients receive individualized care, including medication management, group therapy, individual counseling, and psychoeducation. The focus is on symptom management, skill building, and preparation for reintegration into the community or transition to less restrictive services. Patients in this unit often work with their treatment team to create comprehensive discharge plans that connect them to outpatient services, partial hospitalization programs, or community resources for continued support. Both units are secure locked units and emphasize continuity of care and collaborative discharge planning. The psychiatric department works closely with primary care providers, the county's crisis services, and outpatient mental health services to develop transition plans that ensure patients receive appropriate follow-up care. Case managers and social workers in the inpatient units coordinate with community resources to arrange outpatient therapy, psychiatric follow-up, housing support, financial assistance, health insurance, disability determination, and any other necessary services to promote stability and prevent rehospitalization. The entire psychiatric department functions as a multidisciplinary team, integrating the expertise of medical doctors, psychiatrists, psychologists, psychiatric nurses, social workers, occupational therapists, nursing assistants, mental health technicians, interpreters, and peer support specialists. This approach ensures that care is comprehensive and person-centered, addressing the biological, psychological, and social needs of each patient. Regular team meetings and case consultations help tailor treatment plans to the specific needs of each patient, ensuring the best possible outcomes. The psychiatric department prioritizes safety and security, especially within the involuntary unit. Both units are secured environments designed to minimize risks for both patients and staff. Safety measures include 24-hour monitoring, controlled access, and specialized training for staff to address behavioral emergencies and escalating levels of safety restraints. The voluntary unit, while also secured, offers more freedom and a less restrictive atmosphere to promote a sense of autonomy and empowerment for those who are voluntarily seeking treatment. Patients are accompanied by staff on outings to other areas of the hospital. Family members can accompany patients in the voluntary unit off the property for short durations. The overarching goal of the psychiatric department is to provide effective crisis intervention, stabilization, and treatment in a manner that supports the dignity and autonomy of patients while ensuring their safety and the safety of others. Through its partnership with the County Mental Health Agency and other community resources, the department aims to create a seamless continuum of care, supporting individuals in their recovery journey from crisis to stabilization and eventually reintegration into their community. Let me share some of the details of the role. A mental health technician is a vital member of a healthcare team, working under the supervision of licensed mental health professionals, such as psychiatrists, psychologists, or psychiatric nurses, to provide direct care and support to individuals experiencing mental health challenges. My responsibilities included monitoring patients' behavioral and emotional conditions, assisting with daily living activities, observing and reporting changes in patient conditions, taking and recording vital signs, fulfilling the unit secretary role, and providing therapeutic support in individual settings. Mental health technicians may also assist with crisis intervention, maintain a safe and therapeutic environment, complete light cleaning and stocking duties, and work collaboratively with other healthcare providers to ensure comprehensive patient care. When the units were overstaffed and other units were understaffed, the MHT was floated to other units to fulfill the role of a clinical patient safety attendant. The role requires strong communication, empathy, problem-solving skills, and the ability to remain calm in high-pressure situations. An MHT must possess knowledge of psychiatric disorders, treatment plans, and therapeutic techniques to effectively support the mental health recovery process. I completed my graduate degree internship program at Central Vermont Substance Abuse Services with the Clara Martin Center, designated Community Mental Health Care Services Agency, from July of 2019 until August of 2020. A comprehensive substance abuse outpatient rehabilitation center like the one I worked at is a specialized facility dedicated to helping individuals overcome addiction through a range of evidence-based services. It provides a supportive environment where clients can receive intensive treatment while maintaining their daily responsibilities, such as work or school. The center offers an intensive outpatient program, IOP, designed for individuals who require a structured treatment plan without the need for residential care. The IOP includes structured therapy sessions multiple times per week, focusing on addiction education, coping strategies, and relapse prevention. Flexible scheduling options, including evening and weekend sessions, accommodate clients' work or school commitments. A multidisciplinary approach ensures collaboration among therapists, counselors, and medical staff to address the physical, emotional, and psychological aspects of addiction. Counseling is a core component of the rehabilitation process. Group counseling sessions, facilitated by licensed therapists, provide peer support and allow clients to share experiences, build social skills, and learn from others facing similar challenges. Individual counseling offers one-on-one sessions that focus on personal issues contributing to substance use, such as trauma, stress, or co-occurring mental health disorders. Therapists use techniques like motivational interviewing and cognitive behavioral therapy, CBT, to develop personalized coping strategies. Regular drug testing is implemented to ensure accountability and monitor progress. Random, unannounced tests deter relapse and encourage honesty in therapy sessions. Comprehensive screening tests for a wide range of substances provide accurate assessments, and results are used constructively within the treatment plan while being kept confidential. The center works closely with local mental health organizations to provide integrated care. Referral networks connect clients to psychiatrists, social workers, and support groups for comprehensive support. Joint treatment plans involve coordinated care strategies for clients with co-occurring disorders, and access to community resources provides housing assistance, employment services, and educational programs. For clients who might benefit from medical interventions, the center may refer to partner organizations that offer medication-assisted treatment, MAT, clinics. The center provides specialized services for individuals with substance-related driving offenses through Impaired Driver Rehabilitation Programs, IDRP. Education courses address the dangers of impaired driving and promote responsible behaviors. Comprehensive evaluations determine the extent of substance use and required interventions, and assistance is provided in meeting court or Department of Motor Vehicles, DMV requirements for license reinstatement. Additional services include family therapy, involving family members to rebuild relationships and create a supportive home environment. Aftercare planning develops long-term strategies to maintain sobriety after program completion, including support groups and ongoing counseling. Holistic therapies like exercise, yoga, meditation, and art therapy are encouraged to enhance overall well-being. The staff comprises licensed professionals, including counselors, therapists, receptionists, office manager, program manager, and testing associates who have received specialized training in addiction treatment. Staff members regularly participate in continuing education to stay current with best practices. Facility features include a comfortable environment with safe and welcoming spaces designed to promote healing and privacy. The center is in an accessible location, situated near public transportation and community resources for ease of access. Confidentiality is assured through strict adherence to privacy laws and ethical standards to protect client information. The primary aim of the center is to empower clients to achieve lasting recovery by reducing substance use through targeted interventions and support, improving mental health by addressing underlying issues, and promoting emotional well-being, enhancing life skills by teaching practical skills for managing stress, relationships, and responsibilities, and fostering independence by preparing clients to lead fulfilling, substance-free lives. By offering a comprehensive range of services and fostering collaborations with community partners, the Rehabilitation Center plays a crucial role in addressing the complexities of substance abuse and supporting individuals on their path to recovery. In my time at Central Vermont Substance Abuse Services, I worked directly under a licensed supervisor who worked directly with interns. I learned how to run an IOP group therapy session and a basic skills group. I also attended a co-occurring group run by another licensed clinician and sat in on team meetings each week. I learned other non-clinical skills, like insurance company verifications and record keeping, as well as timely documentation of progress notes and treatment plans. I worked at the Baymark Health Systems BART Clinic in St. Albans, Vermont, from September of 2020 until June of 2021. I worked here as an apprentice addiction professional and pre-licensed MAT clinician under supervision, accruing my legally required direct and indirect service hours. Baymark Health Systems is a leading provider of medication-assisted treatment services for individuals struggling with substance use disorders, particularly opioid addiction and dependence. Headquartered in Louisville, Texas, Baymark operates a network of outpatient treatment centers across the United States and Canada. The for-profit organization specializes in evidence-based treatment modalities that combine FDA-approved medications, such as methadone, buprenorphine, Suboxone, and naltrexone, with counseling and behavioral therapies to address the comprehensive needs of patients. In Vermont, Baymark Health Systems extends its services through its subsidiary clinic, offering medication-assisted treatment to individuals seeking recovery from opioid dependency. The Vermont Clinic is committed to providing patient-centered care that addresses both the physical and psychological aspects of addiction. Utilizing medications like methadone and buprenorphine, the clinic aims to alleviate withdrawal symptoms and reduce cravings, thereby stabilizing patients for further treatment. The clinic provides individual and group therapy sessions led by licensed and pre-licensed counselors to explore the underlying causes of addiction and develop coping strategies. The clinic conducts thorough physical examinations and psychological evaluations to create personalized treatment plans tailored to each patient's unique needs. The clinic offers additional resources such as case management, health home services, which includes collaboration with primary care physicians, referrals to community services, and educational programs on relapse prevention and life skills. The clinic offers flexible scheduling options, accommodating patients with varying schedules by offering appointments at different times, including early mornings starting at 5 a.m. The Vermont BART Clinic, operated by Baymark, aims to create a supportive and non-judgmental environment where patients can work towards sustained recovery. The multidisciplinary team comprises a medical doctor, nurses, counselors, security, and administrative staff dedicated to helping individuals regain control over their lives. By integrating medication with psychosocial support, Baymark's Vermont clinic strives to improve treatment outcomes, reduce the risk of overdose, and enhance the overall quality of life for patients and their families. While at Baymark, my role included conducting assessments for intake, reporting documentation during the intake, creating integrative summaries, creating treatment plans, conducting individual and group counseling sessions with patients, managing collaboration with partners in the community within the Health Home Services program, assessing and discussing drug test results with the patients, writing progress notes, recording clinical work hours, writing discharge plans and discharge reports, witnessing drug testing, and conducting drug testing with patients. While still working at Baymark, I began building a private practice and rented an office in South Burlington. I eventually left Baymark and started working in private practice full-time. I worked under supervision in my private practice role from December of 2020 until May of 2023. I reported to 2 clinical supervisors. One was a licensed clinical social worker and licensed alcohol and drug abuse counselor, and the other was a licensed clinical mental health counselor. I received my state license to practice mental health counseling in May of 2023. Thank you for letting me share about the different programs and organizations I have worked for. What's next? What is there left to do? In addition to curating content on the different social media platforms and websites, I would like to expand Strengthening Your Conscious Self into a book, mental health retreats, and a holistic health and wellness movement. Imagine checking into a 6-week resort stay and you have to voluntarily give up your technology devices, coffee, alcohol, drugs, sugar, gluten, dairy, salt, or any other toxic or addictive device, substance, and behavior. A comprehensive retreat with spa treatments, massage, yoga, tai chi, mental health workshops, meditations, nutritional coaching, life coaching sessions, physical fitness training sessions, and much more. You'll attend introductory classes on philosophy, neuroscience, psychology, medicine, nutrition, critical thinking, biology, anatomy, and physiology, and many others. You'll have quiet reflection time, group activities, classroom settings, and other social events during your stay. Meals will consist of organic fruits, non-gluten grains, legumes, nuts, whole raw vegetables, vegan options, vegetarian options, non-dairy milk options, clean sources of proteins, fats, vitamins, and minerals, with clean air and clean water. Most proteins will consist of seafood, eggs, and chicken. Very minimal, if any, red meat or pork will be consumed. You'll be secluded away from light and noise pollution, and you'll have to undergo a complete neuropsychological, mental, emotional, and physical evaluation when you arrive and before you leave. The results of all your tests and the changes you might undergo during your stay will be shared with you through a client account portal after departure. These retreats will be offered at existing budget-friendly properties, and a lottery will be conducted for admissions. These retreats will not qualify as substance use disorder rehabilitation programs, but you might undergo some detox and withdrawal symptoms. So, keep an eye out at your favorite bookseller for my book and keep up to date with this channel for updates on the retreat offerings. That concludes this video and the work history segment of my professional public disclosure statement. Thank you for taking the time to watch this video, like it, and subscribe to the channel if the moment moves you. Don't forget to reward yourself for making the time and effort to take care of your health and wellness. I invite you to watch the next videos to learn about my approaches to therapy and my theoretical orientation.